Hi, my name is Dario Ghostin, and my presentation is on acute myeloid leukemia. Addie, 14 years old. Disease and treatment. Disease, acute myeloid leukemia, a rapid progressing cancer of the bone marrow and blood. It affects the myeloid cells of the white blood cells. Normal cells' DNA tells the cells when to grow and die off, but mutated DNA cells tells the cells to continue to grow and divide instead of dying off. When this occurs, the bone marrow starts to produce immature cells that matures into myeloblasts, leukemia white blood cells. Due to the mutated DNA cells never dying off, the leukemic white blood cells build up in the body and take over the healthy cells. Diagnostic tests include patient history, bone marrow aspiration/biopsy, CBC, and a blood smear. Treatments include induction therapy that lasts 4 to 5 weeks. Chemotherapy is administered and usually results in remission or less than 5% leukemic cells in the bone marrow. CNS prophylactic therapy is used to lower the risk of leukemic cells entering the CNS, usually in the form of cranial radiation. Intensification therapy is chemotherapy that is administered over 6 months to prevent the remaining leukemic cells from dividing or mutating. Maintenance therapy is a combination of medications that is administered to ensure that the patient remains in remission and does not build resistance against the medication. Stem cell transplant replaces the patient's bone marrow with leukemia-free stem cells to promote the growth of new healthy bone marrow. Pain and constipation. Pain. Patients may suffer pain due to the buildup of cancer cells and bones. Opioids are used to sedate patients while still being arousable in end-of-life care. A combination of opioids and other pain medications is usually common. If patients is unable to report pain or pain can't be managed, a high dose of opioid and sedation may be administered to ensure that the patient does not suffer during the end-of-life care. Parents should be made aware that pain medication is needed to treat pain, but does not cause the patient to pass away quicker. Non-pharmacological treatments include distraction, guided therapy, relaxation, cold and heat therapy, and frequently repositioning the patient. Constipation. Chemotherapy medications can cause nerve problems in the bowels, which can lead to constipation. Continuous use of opioids prevents the digestive tract from voluntarily contracting and relaxing the muscles, ultimately causing constipation. Rectal ulcers can also lead to discomfort while the patient is having a bowel movement, therefore causing the patient to, by choice, avoid having a bowel movement. Interventions include administration of laxatives and stool softener, record the patient's bowel movements on a bowel chart, increase fluid intake, includes fiber intake in the diet, and increase physical exercise. Nausea, vomiting, and fatigue. Nausea and vomiting. Due to the administration and effects of chemotherapy, drugs, and opioids, the patient may start to feel nauseated and induce vomiting. Treatment. Administration of an antiemetic before chemotherapy is recommended, such as Zofran and Gravol. If it cannot be given before chemotherapy or opioid administration, antiemetics can be administered after. Eating bland food, avoiding spicy food, eating smaller meals, relaxation, and breathing techniques is other treatments. Fatigue. AML affects the patient's blood and causes the production of red blood cells to slow down. This can cause the patient to become anemic, leading to fatigue. Treatment. The patient may require blood transfusions or bone marrow transplant. Oxygenation therapy can reduce the risk of the patient becoming hypoxic. Nutritional diet and diet education can help reduce anemia when combined with other therapies. CNS symptoms and anxiety. CNS symptoms. Patients that have leukemia is at risk for the leukemic cells entering the CNS, including the cranial and spinal nerves. To prevent this from happening, prophylactic therapy such as cranial radiation can be administered. If leukemic cells enter the CNS, it can lead to many complications such as extremity weakness, radiating pain, including voiding, paralysis, and leukemic meningitis. Anxiety. The patient and their family can become anxious due to the disease diagnosis, treatment process, fear of pain, and disease progression. To help lessen the anxiety of the patient and their family, the nurse can assist with coping strategies, help the family process their emotions, hold open discussions, help maintain a calm and normal environment, and encourage the family to stay close by the patient. As a last resort and usually during end-of-life care, pharmacological treatment such as lorazepam is started. Skin problems, infections, bleeding, and muscle spasm. Skin problems. As the patient is at risk for infections, it is essential to complete frequent skin and mucous membranes assessment. Skin punctures should be avoided. However, if this is not an option, the patient should be monitored for bleeding and infection at the site. Treatment for skin problems include antibacterial topical ointments and creams, keeping the skin clean and dry, wearing loose-fitting clothing, and keeping the nails groomed. Infection. Leukemia causes patients to have a low count of neutrophils, which can lead to infection. Prevention of infection is key by completing skin assessments, monitoring temperature, proper diet and nutrition, proper hand hygiene, and keeping the patient's environment free from germs. Antibiotics can also be administered if the patient has an infection and can also be administered prophylactically. Bleeding. Patients with AML have low platelet counts, therefore they are at risk for bleeding and hemorrhaging. Platelet transfusions are the last resort of treatment. Patients and families should be taught to put pressure at the site of bleeding to control the bleeding. Monitoring bleeding, monitoring CBC labs, administration of clotting medication, using soft bristle toothbrushes, and using a safe electric razor can also be recommended. Muscle spasm. Due to the patient having low red blood cell count, there is less oxygen being transported throughout the blood into the muscles. This can lead to muscle spasms and cramps. Blood transfusion, supplemental oxygen, muscle relaxers, and physical therapy are suggestions of treatment. Nursing diagnosis. Complicated grieving related to anticipatory loss of a child as evidence based by parents feeling very distressed and extremely frightened due to the progression of their daughter's disease. Goal in nursing interventions. Goal. The patient's family will express appropriate feelings of guilt, fear, anger, or sadness, be able to identify distress associated with grief, and demonstrate effective coping strategies after 2 weeks of seeking mental health services and attending grieving programs. Nursing interventions. The nurse will encourage Addie's family to show their caring feelings and talk to Addie. Rationale. The research demonstrates that deathbed phenomena brings comfort, peace, and reassurance. Encourage parents to seek mental health services or programs to help facilitate grieving. Rationale. The death of the child is regarded as one of the most traumatic, incomprehensible, and devastating of losses, with the potential to precipitate a crisis of meaning for the bereaved parent. Goal evaluation and reflection. Goal evaluation. After 2 weeks of seeking mental health services, Addie's family could appropriately show and express their feelings of guilt, fear, anger, and sadness towards the acceleration of Addie's disease process. Addie's family was also observed caring for and holding conversations with Addie. During difficult and stressful times of care and disease progression, the nurse observed the family independently implementing effective coping strategies. After multiple conversations with Addie's parents, it is evident that her parents are at terms with Addie's disease prognosis and is focusing on caring for and spending time with Addie. Reflection. The family-centered care approach allows the nurse to build a strong therapeutic relationship with the patient and their family. With this approach, the nurse can also consider Addie's family needs and care for the family simultaneously while caring for Addie. This can include discussing and including them in Addie's care plan, actively listening to their feelings, and teaching them coping strategies. The multidisciplinary care approach allows multiple healthcare professionals to collaborate and care for the patient and their family. Taking this approach allows the physician, nurse, pharmacist, social workers, and chaplain to address all aspects of care while advocating, counseling, and supporting the patient and her family through this challenging time. Here are my references, and I would like to thank you for taking the time to listen to my presentation.